Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Welcome again to the Stem Cell Healing Institute podcast. I'm here once again with Dr. Sara Figueredo. Hello, doctor. How are you?
Hello, Luis. Thank you so much. I'm great. Happy to be here, as always.
How was your trip to Costa Rica?
Yes, thank you for asking. Yes, I was seeing patients and doing a little sightseeing, and I have a lot of patients out of Costa Rica because stem cell treatments are not legal in Costa Rica. So
really?
I have, yes, and so for disease conditions. So I have a lot of patients there that come to Guatemala for treatment, and thankfully for them, it's so close, and so it's not a long trip. It's about an hour and a half by plane.
Okay, so it's nice to have you back. We're going to talk today about chronic illness and autoimmune diseases.
Great.
And well, I have to ask you, what are the autoimmune diseases?
Very good question, Luis. So autoimmune diseases in general are diseases where the body is attacking itself. Auto means self. Autoimmune means that the immune system is attacking the body. Okay, your own body. And what happens is there are antibodies that are created for whatever reason. Many times the autoimmune disease cause is unknown. But in many times also there is a trigger. Okay, and so what happens is the body creates antibodies that attack the body's own tissues as if it's foreign. And so that's what essentially happens in autoimmune diseases. And there are a number of different autoimmune diseases. For instance, diabetes type 1 is an autoimmune disease where the antibodies are attacking the cells of the pancreas. And in that case, the islets of Langerhans cells are not able to create insulin. Okay, so that's what happens in diabetes. And then there's multiple sclerosis, which the antibodies that are created attack the myelin sheath, which is basically the covering of the nerves. Okay, so it deteriorates the nerves, and then it inhibits motor function over the long run. And patients end up in wheelchairs and devastating things like that. And that's what happens in multiple sclerosis. And then there's rheumatoid arthritis, which is another autoimmune disease where the antibodies are attacking the joints, the cartilage in certain parts of the joints. And so we get a lot of pain and degeneration of the joints and swelling also. And then we have scleroderma, which is another autoimmune disease, lupus. And lupus comes in so many different forms. Sometimes many times it'll attack the joints, it'll attack the skin, it'll attack different organs. And so lupus is quite devastating also. So that's sort of autoimmune diseases in a nutshell.
Also the thyroid issues, because I had the thyroid issue. That's another one, right?
Yes, that's correct. Like Hashimoto's, absolutely.
Exactly.
Yes, thyroid diseases. Mm-hmm.
So can we say that these diseases, the autoimmune diseases, do they run in the family?
That's whether it's hereditary.
Yeah.
Absolutely, it can be. Yes,
it can
yes.
be. Okay.
So if it definitely, these diseases are something that can run in the family, and have this genetic hereditary aspect to it. Also, there are triggers. For instance, there are some studies that show that diabetes type 1 can be triggered by milk proteins at a very young age. Okay, very interesting.
Mm-hmm.
So, drinking milk from a very young age, in some cases can trigger the casein can trigger an autoimmune response, and then we can end up with diabetes in this case. And also, we find that eating a lot of pork, in some cases, eating a lot of pork can trigger autoimmune diseases. And also chronic illnesses like chronic colds or flus, because your body's constantly creating antibodies to fight uh, those types of conditions. Sometimes something can go haywire, and we start to create antibodies instead of attacking the flu virus. It just sort of can just go wrong. Something can go wrong and start attacking the body, and so there are different ways and triggers that can cause autoimmune diseases if it's not just straight out genetics or hereditary.
Very interesting. And none of these illnesses can be cured, but they can be treated, right?
You know, they currently they're being treated by mainstream medicine with medications, pharmaceuticals, painkillers, steroids. So currently they're treated to some degree, or in the case of diabetes, it's insulin. However, mainstream medicine does not have a cure. Stem cells can potentially cure or at least put in remission indefinitely these types of conditions. That is the goal of stem cells, is to not only stop the autoimmunity, so stop the creation of new antibodies and stop the antibodies from attacking the cells of your own body. However, the goal is also to repair the damage that's been done by the antibodies attacking the tissues. So we accomplish both of these things with stem cells, and and the potential is there to put someone in indefinite remission, if not cure them. So it's and repair the damage that's been done. So that is it's very fascinating, the potential of stem cells.
So we basically reprogram these cells so they can regenerate, right? That's how we do
Yes,
it.
exactly. So with autoimmune diseases, it's a unique way of deploying the stem cells. What we
Okay.
do is, or applying the stem cells, basically. What we do is a couple of different things, depending on the condition. But with all autoimmune diseases, we will apply the stem cells into the lymph nodes. Okay, so where the lymph nodes are where the immune system starts. So, or at least the circulation of the immune system. So we put the stem cells in the immune system plus in the veins, an intravenous IV of stem cells. And then if we're dealing with conditions that have specific local applications of stem cells, for instance, with rheumatoid arthritis, we may want to inject right into the joints. So we would do that also. So we leave no stones unturned, depending on the disease condition being treated.
And also for the skin problems, you put it locally, right?
Yeah,
Or,
exactly. That's correct.
okay.
Yes.
Doctor, what will be exactly the involvement in the stem cell treatment?
Okay, so basically, what is involved in the stem cell treatment is it's a very comprehensive treatment. Okay, so we start with pre-treatment, and this begins even before the patient comes for treatment. Is we start a pre-treatment protocol with just cleaning up the diet a little bit, nothing too drastic, but cleaning, doing some of the key changes, adding key supplements such as vitamin D and omega-3 and antioxidants, and that's before they even come. And then once they come to Guatemala for treatment, we start them on a detox. It's called the Total Detox Program, and it's an IV it's a nutritional IV with high amounts of antioxidants and minerals and B vitamins that help start the detoxification process of the liver. And we follow that up with coffee suppositories that again just sort of enhance the IV and enhance the detoxification in the liver. and intramuscular injections of B vitamins. So that's the total detox program that we start with. So we start with the total detox program, and then we also, at the same time, we start on oxygen therapy. You exercise with oxygen therapy or hyperbaric oxygen, which we decide depending on the condition of the patient, which would be more suitable for them. They're both quite equivalent, and and all of these, the total detox, the oxygen, and then depending on the age of the patient, we would start them on also growth hormone therapy, and also a stem cell enhancement formula. So those are all four components that go along with the stem cell treatment, just to enhance the body, enhance the results, and preparing the body to receive the stem cells and for the most effective treatment. Okay, so we do all that with the actual stem cell treatment when they come.
And,
Go
and,
ahead.
and how long would this take? Like these treatments, I'm sure they take different times because different diseases. But
In general, before they come, because we have a lot of patients coming from out of town. Most of the patients are coming from out of town because this treatment is not available in North America, nor is it available in Europe and a lot of different places in the world. So before they come, we start them on the pre-treatment protocol, and while they're here, we have them here from 7 to 10 days. Okay, to complete everything. And then when they go home, we send them home with growth hormone as well as the stem cell enhancement formula. So everything from start to finish lasts about 3 to 4 months. But they're not here 3 to 4 months. They just continue the treatment at home up to 3 to 4 months, and they're only here from 7 to 10 days, depending on what we're going to do and what we're going to treat.
that's great. So that sounds like they get the treatment, then they take some homework.
Yes, that's right.
Doctor, not only these treatments, but the other ones, people can come to see our website, and that will be www.stemcellhealinginstitute.com. And where can they write you if they will have any questions?
Oh, yes, sure. That would be info@stemcellhealinginstitute.com. So they can reach us at www.stemxcure.com. Also, www.stemcellhealinginstitute.com. And they can write us directly at info@stemcellhealinginstitute.com.
That's great. Thank you, doctor. And welcome
Thank you
back.
so much. Thank you. It's always a pleasure to be here, and happy for the weekend. Have a
Okay.
great weekend, Louise.
You too. Take care.
Thank you.